I'm very pleased to welcome Professor Lindsay Forbes and Dr. Sarah Hotham, who are going to talk to us about prevention is better than cure, building capacity to research what does and doesn't work to improve the health of the public. So very important topic for all of us, because we are all the public, as well as being researchers. We all have an interest in the wider community health, I'm sure. So Lindsay and Sarah are both colleagues from the Centre for Health Services Studies at the University of Kent.
Lovely. Thank you very much, everybody. So we call this prevention is better than cure because we're very keen to, Sarah and I are very keen, and indeed the wider team, very keen to emphasise that public health is largely about prevention of ill health. And wanted to sort of, it seems a sort of obvious aphorism, prevention is better than cure. The first coined, I believe, by the philosopher Erasmus many centuries ago, although recently, a couple of years ago, I think Matt Hancock claimed it as his own invention. But it seems obvious to everybody that prevention is better than cure, but how to actually do it is something very much more controversial and difficult to get to the bottom of. But that's what public health is all about. And this is, as Mel said, this is to report on a project that we were funded by NIHR to do last year, which we did with the great help of the councils, members of the public, and our colleagues in academia, under very difficult circumstances because of the pandemic, but we still managed to get it done. And we think there was a lot of useful learning from it at both a local and a national level. So we want to disseminate it as widely as possible. So that's why we're telling you now about it. See, I'm not, there we go. The first thing, just to set the scene for this, I just wanted to remind everybody what determines health. The health of the population is nothing really to do with the health service. The health, all of our health is largely determined by factors in our environment, our infrastructure, our income, our education, the psychosocial environment in which we were brought up, our access to healthy food, and our, all those things that kind of intersect. They cannot be seen independently. People's behaviours are largely determined by the environment they grew up in, and the ongoing environment as well. And we can't really achieve behavior change without thinking about what makes people behave in certain ways. So I just wanted to emphasize that before we start, that what most of public health is about what are called the wider determinants of health. And thank you very much for the Health Foundation for this infographic, which I pinched. And the other bit of context I wanted to share with you, and I think people kind of know this, but I think it's very important to remind people that since the Health and Social Care Act removed the responsibility for the health of the public from the NHS in 2012, and gradually since then that responsibility has been very much taken over by local government. Public health used to be part of the NHS, but it was very much recognised that it wasn't necessarily the right place for it, because, as previously discussed, health services do not determine health. There are some health services that have more impact on health than others. I mean, maternal and child health we could start off with. I mean, there's a really big role for health services in those. And in fact, some of those services have been moved to local authority as well, though not all. And there have been several implications for research into the health of the public from this change of home for public health. The research culture, which is fairly well embedded in the National Health Service, hasn't always been, but certainly in the last 25 years, there's been a major move to embed research culture and indeed research support in the NHS. And that basically means resource, and as well as a statutory commitment to do research in NHS organisations. By support, I mean the R&D offices that some of you here I can see work for. You know, those are all about embedding research into the NHS. Such a thing does not exist in local government at all at the moment, though watch this space. The drivers of activity and the drivers of change are very different in local government than in the NHS. There are local political drivers largely which determine how money is spent. And the other major difference is that it meant that what has happened over the last 10 years is that the funding for public health research has fallen in line with everything else that's been subject to austerity. And as I'm sure most of you are aware, the NHS has been much less, lost its funding much less markedly than local government. And the public health grant, which is meant to go to prevent ill health in the population, has been also cut. And that means that any research that public health people might have done in local government has also been cut, much more than in the NHS. I mean, the NHS hasn't been a walk in the park in the NHS either, but the situation in local government has been much, much worse in terms of funding. So just to emphasize again that local government has the primary responsibility for health. So differentiating it from health services, which is what the NHS has primary responsibility for. And this is almost certainly the right place for public health to be cited, because the work of the local government profoundly influences the determinants of health. And public health, and indeed all local government practitioners, so not just those sitting in the public health department, are those who are best placed to tackle the environment, the psychosocial environment, as well as the physical environment, the unhealthy infrastructures that cause ill health. The problem is that the evidence base for what local government can do to promote health and to prevent disease is relatively weak, as is the evidence base for what they should not be doing. I have to say there's also an issue about implementing the known evidence base, that they trying to make the science speak is not always easy in local government. I have to say it's not always easy in the NHS, as many people, those of you who work in the NHS will agree, but it's a whole lot worse in local government, trying to get the evidence base into practice. I'll just leave you on the end of this slide with the thought that, you know, the enormous numbers of deaths that occur every year, including in Kent and Medway, as a result of poor air quality. But we don't see local governments focusing their efforts on reducing car use sufficiently, I would argue. So the NIHR has actually really upped its game in the last few years, and particularly in the last year or so, to try and address this slim evidence base for what local authorities should and shouldn't do. They've been building up the public health research programme, which has been around for a long time, but it's really developed a lot more in the last few years. There's increasing support for public health projects from the Research Design Service and the Clinical Research Network, both of which were very much designed to support clinical research, so research in the clinical environment, but they have really developed over the last few years to start to support public health research. It's not entirely there yet because there was a huge cultural change required, and a huge skilling up of the workforce also required. But it's getting there. There have also been public health intervention responsive teams set up. That's been just in the last year, which are kind of peripatetic teams which are made up of academics who have experience in public health projects, in evaluation essentially of public health interventions, who can be helicoptered in to do projects for local authorities. I mean, obviously co-producing, but the key thing is it's not coming in and advising them, it's coming and actually doing the data collection, doing the analysis, actually doing the stuff they really don't have time to do. And then what I'm going to talk about in a minute is, well, in less than a minute, I hope, is our project, which was part of a series of projects. 14 projects were funded by NIHR last year, and these are called the Local Authority Research System projects. And we bid for one of these and won it. And at this point, I think I'm going to hand over to Sarah, who's going to tell us a bit more about the actual project, and then I'll round off at the end, if that's okay with you, Sarah.
It certainly is, Lindsay. Thank you very much. So thank you for setting the scene quite nicely. So as Lindsay mentioned, we were lucky enough to be successful in gaining a sort of some small amount of funds, but a chunk of money really from the NIHR to start to really try and understand what are those barriers and enablers in local authorities to doing research, because I think there's a real sense from the NIHR, who's arguably the largest funder of sort of health and social care research in England. They recognise that there needs to be more work done with public health and building capacity in people who work in public health to do research. So for their perspective, they wanted to get a broad understanding of what those barriers were, like what's happening already, where is there good practice, what enables that good practice to happen, but where there are barriers and things that get in people's way or challenges, what they are, and importantly, thinking, forward thinking, how can we sort of approach those barriers and take those barriers down and work with people to understand the things that's stopping them in local authorities and public health teams to doing research. So we were lucky enough to get the money. We did this in collaboration with, it was with Kent County Council and Medway Council, and we had quite a really sort of interesting sort of multidisciplinary team that was academics, but it was also public health consultants in KCC, and we have an embedded researcher in Medway, and then we had a public advisory group as well. So that kind of were sort of co-applicants on the bid. So our main aim really was just to understand what's going on in terms of research with the two local authorities. And we kind of had an idea, really. Lindsay and I already do work with Medway and with KCC, so we kind of anecdotally knew what some of the barriers might be and what makes it maybe easier. But of course, we wanted to be able to sort of document that in a really robust and valid way, and we were able to do that with the funding that we got. Lindsay, may I have next slide, please? Thank you very much. So the actual study itself, we wanted to take on a sort of a broad range of evidence to try and understand, what the landscape was. So what we thought we would do is we'd use different avenues to gather this data. So we were quite traditional in one approach where we designed a survey, we co-produced a survey with our public group, our public advisory group, with our sort of collaborators in the local authority, to sort of answer questions around what people's current activity was with research, what they understood to be research, any experience they had in doing research, and what made it easier for them to do it, what made it harder. And so that was an online survey, and that was distributed across both the councils, so Medway and Kent, and across all departments. It wasn't just in public health. I think we have to be really clear on that, is that we were looking at, bearing in mind the wider determinants, as Lindsay so nicely sort of started with. We know that public health just doesn't sit in public health teams. It will sit in housing, it will sit in transport, environment. All these different departments have a role to play in public health. So the survey went out across both councils and across all jobs. So it went to councillors as well and council officers. And from that, we got quite a nice sort of sample back of just under 400 people who took the time to sort of do the survey, which we're very impressed with, given that we're sort of peak COVID at that time as well. So we got a really good understanding from that data of what the barriers and challenges and what the current sort of situation is. We also wanted to do a few in-depth interviews. It was a 4-month project, I think, Lindsay, was it 3 or 4 months? I can't remember. So it's a very short turnaround that 4 months, yeah. And we had to do quite a lot of work. So acknowledging that we couldn't probably do swathes of interviews in that time, we targeted people. We were quite strategic in our thinking, and we purposely selected people from different levels in the council. So we had councillors that we wanted to interview that had a specific remit for health and social care. We wanted to interview directors of public health, but also senior managers and other sort of departments in the council, but also wanted to speak to people who were like maybe programme managers or specialists who are sort of more sort of, I guess, front facing, or sort of, different grades to the sort of higher managerial side of it, and may have different perspectives on research. So we did those interviews, and we also went to some meetings. We sat and observed a number of meetings that were relevant. So some of the STP prevention workstream meetings we went to, one of the Medway public health meetings, and we were just there to observe and just to make note of any time research was spoke about and how it was spoken about and who brought that up in the conversation and what was the response to that, just to be able to get, again, just some interesting observations from the dynamics of, meetings when someone mentions research. What is the response to that and how is it viewed by people? And then finally, we did a consensus workshop, which just involved getting 20 people from across both those councils in a room to talk through a series of questions in a bit more of, I guess, an informal way. And just try and find out some answers from these thinkers, I guess key thinkers, key informants in Kent and Medway around how we think we can take this work forward. What it's okay finding this out now, but we need to build on this and sort of try and start to solve the problems that we may have identified. Thank you, Lindsay. So what did we find from doing this? So we've got lots of findings and we can't possibly talk about them all today, but I think Lindsay and I wanted to pull out some really key sort of observations from that data that we thought might be interesting to share today. So when we got the survey findings back and looked at the interview data, I think what we found was, pretty much everyone agreed that using research evidence is important. They want to do it. They recognise that it's a good way to make decisions. It will improve decision making if you use evidence, and that's decision making with designing services or commissioning services, whether that's using evidence to evaluate it. There was an overarching sort of, I guess, unanimous almost understanding that research evidence is important. And that local government has a role to play in contributing to that evidence. So, local work is important and valued and can inform national sort of research and services. So it's not just that we're doing research locally and it stays locally. The aspiration is that that gets fed into bigger national programs. And that really came through quite strongly in the data as well. So we have an aspiration that to engage in research, absolutely. People knew it was important, so it's very positive attitudes. I think what we found in terms of the actual practicalities of doing that didn't always match with the aspiration to carry out that research. And there was no one thing really that prevented people from engaging in research, but there's certainly I think overarchingly probably the most common thing was a lack of time and capacity to really sort of almost get your mind into something that is not in your day-to-day business. It really tried to sort of, it felt like it was a bit too much of a leap sometimes for people just to start research or to start thinking about how what they're doing could be, sort of used as research. Although people had the skills, they had the training often, they understood what research was and important. It was just, I think we've heard this before, it was just, limited time in the working day to be able to do it. And, certainly in COVID times, pushed back arguably because, not arguably, more important things were taking people's sort of work day. But mindful of the importance of research, nevertheless. Lindsay, may I have the next slide, please? So I think, well, just to sort of, we overarchingly also saw, sorry, I'm just trying to think where we've got to, but yeah, the public were sort of similarly, the members of the public that were involved in our research, whether that be in the advisory group, but we also invited members of public to our consensus workshop. They also saw the value of embedding research in the design of services and the evaluation of services. So I think, again, it's something that council members want to do, the public thinks important, there's kind of a swell of sort of appreciation that this really is something that nationally needs to be sort of moved forward. But we recognise that it's not, of course, it's not that straightforward. If it was, we'd probably be doing it. But there's a little bit of, I guess, sort of building knowledge and awareness of how the systems work in local authorities and in universities. So, Lindsay and I will attest to this quite a lot in that, we are very much aware that going for research funding is very time consuming, but can also be a bit slow. And it's not often very reactive in the sense that you often have to wait sort of 9-12 months for a decision, and if you got the funding then you could then start the project. But of course local authorities may want evidence quicker than that. They may want to be able to get on with the piece of work that you're sort of interested in. So there's a bit of a mismatch really sometimes, I think, we find with the sort of the way that the NIHR works, particularly, or funders more generally, and the sort of priorities and needs of local authorities and how quickly they can sort of that they may want that evidence. And sort of how we can sort of navigate that landscape is quite challenging in some ways. But also, universities do not have resources or the infrastructure just to support research in local government. So it would be great if we could offer, sort of immediate or reactive, support to local authorities within our current jobs or our job roles. But of course, that's not necessarily the case. Or we've got funding that we need to get in to support our own roles. And again, how does that match with what the priorities of a local authority are? And I don't know, Lindsay and I can maybe speak to about the new roles that we've got around. We're both embedded in Kent County Council at the moment, offering sort of a research advice service to try and navigate some of these problems. And that's maybe one solution that kind of the NIHR is looking at to sort of bridge that gap between academia and local authorities. Lindsay, I think I'm back to you now, is that right?
That's fine.
Lovely, thank you.
That's great. So we made some recommendations. We made national recommendations and local recommendations because, there's a tendency to think that all the recommendations can be local and just get people to work a bit harder and then, it can all happen. But it was very clear to us that there was a need for some national commitment to support more research in local government. And that was one of our key recommendations, that the research and development function in local government couldn't happen unless it had something like the NHS has, which is well-funded R&D offices. And as I'm sure our NHS colleagues who are here recognise that doesn't necessarily solve all the problems, but at least you've got some support for research to happen and support for data collection and support for, for putting in applications and, all the things that R&D offices do in the NHS, which doesn't currently exist in local government. And local governments can't just reorganise themselves to suddenly resource that. It's not going to happen without national commitment to that idea. I feel very strongly that we need to reinforce the independent advocate role of the Director of Public Health. Directors of Public Health are meant to be able to speak out about the threats to the health of their local population. Sorry, didn't manage to do that. And they are also meant to follow the science. They're not meant to be corporate. The role of the Director of Public Health, which was invented when it was still in the NHS, was very much as independent advocate for the health of the public. I have to say that's one of the reasons why, because Directors of Public Health were often made to be corporate, that was one of the reasons for the return to of public health to local authorities, because the medical officers for health in local government several decades ago were famously, that was very, very important, their independent role as advocate for the health of the public. And if you're going to follow the science, you need to have access to the science, is the key thing. Also, I think it's really important there is national reinforcing of the idea that if you're going to come up with the ideas for research, you need to go to the practitioners. This is a no-brainer in the NHS. You wouldn't ask somebody who wasn't a clinician, about ideas to, improve clinical care. You go to the practitioners to come up with the ideas. Also, practitioners you need in the NHS, you need clinicians to deliver the impactful research. You can't do it without them. And so it's very important, I think, we recognise that in local government as well. The other thing is, as Sarah alluded to, the issue of NIHR funding is not particularly local government practitioner friendly. Timescales, the bureaucracy, the language used. I mean, I think a lot of it needs translating at the best of times, but particularly for local government officers. So locally, what we thought we could do is build stronger networks of practitioners and academics across who are interested in public health through the opportunity that the ARC provides for us of a network of organisations, and that's one of our local recommendations. The other one was building a more compelling case for research locally, and that's about winning over the hearts and minds, trying to explain this idea about being an advocate, that's public health practitioners as advocates for the health of the population, or in particular the director of public health, being advocates for the health of the population, and that needs science. Anyway, those were our local recommendations. Nationally, what actually happened is that there was quite a lot of agreement between the ours and the other 13 projects that did the local authority research system projects. And in fact, quite a lot has come out of it following that. Well, actually, the funding for public health research is embedded in local government came up before that. There have been some local moves to do that. Our colleague Emma Hendricks at Medway Council, her role predated the current stream of national funding, but there is currently national funding for one embedded researcher in one local authority in each region of the 15 regions. So that's 15 researchers being funded nationally. And in fact, Sarah, Nardine Hendry and I are providing that service in KCC now. The other thing that's happened is that a lot of funding has come out of the Centre for out of hospital research. I put that in brackets because it's not entirely, that can mean many things. Of course, general practice is out of hospital, community services are out of hospital, social care is out of hospital, and public health services are out of hospital. But there's been a huge amount of funding committed to supporting out of hospital research, sort of infrastructure, in the recognition that it doesn't have anything like the amount of infrastructure that supports research in the NHS, so clinical research. And very excitingly, there's a call about to come out in autumn this year to bid to provide health determinants research collaborations, which will be a lot of money over several years to provide the infrastructure for research for public health in local government, very much recognising the wider determinants of health, the role of housing, transport, planning, the air quality, I could go on. in research into those things, and the clues in the names there is about health determinants. So very much focus on that kind of endeavour. So in Kent, Surrey and Sussex, as I said, Sarah, Nardine and I are providing this embedded researcher role in Kent County Council. It was initially until March next year, but there's just been a recent announcement that funding is going to be extended for another year, which is great. The other thing we're developing is a more robust communication network, public health network. And my last 2 slides are just about what we're trying to achieve with that. And we've met 2 or 3 times only at the moment, and it's very much sort of storming and forming at the moment. Well, storming and norming probably more than anything else. I mean, we are still just developing sort of terms of reference and you know what actually we're trying to achieve. But the most important thing is that already we've got representatives of every one of the 6 local either unitary or upper tier councils, not lower tier councils yet, of which there are many across the patch. But we have started to talk to each other regularly, and already I think there's some creative work coming out of that. And what we're trying to achieve is you know, develop a healthier research culture, develop research capacity, you know, to promote more research participation, take hold of the opportunities that are available for doing more research, and to ultimately achieve research impact. And so what we're going to do, I think this is my final slide, apart from my acknowledgements at the end, what we're trying to do is to disseminate, and I use the word carefully, intelligence here. It's not just information about research opportunities, but trying to sort of translate some of the opportunities to make them relevant to local government, and try and make sure that people in local government can, you know, understand what's going on in public health research more easily, because they don't have time to pore over documents, and provide opportunities basically to build collaborations is the most important thing, because nothing will happen unless we actually have collaborative projects together. But it's also a forum for sharing and testing our ideas, and developing all sorts of ideas about how we're going to do the research and spread the word about the research as well. The other thing is also just to provide some resource for professional development, which is important to all of us. So that's a very exciting development, and I think that's developing well at the moment. So I'd just like to thank everybody who took part in this, as the rest of the CHSS team and all the people at the KCC and Medway Council who contributed. Special thanks to our members of the public, the steering group, and everybody who took part in the project. And of course we have to thank our funders and also the people who helped make it happen in the CRN, and of course the ARC. Thank you very much.